Birmingham. Namaste and good evening to you all. Hindu Council of Birmingham are pleased to host a dementia seminar tonight. To present the topic on dementia, we have Ruth Chauhan, a health and wellbeing specialist. Welcome, Ruth, tonight, and thank you for presenting the seminar tonight. Ruth Chauhan is skilled in healthcare consulting and training with a focus on improving health and well-being. Ruth is an experienced independent consultant with over 30 years experience in senior nursing and management positions within the NHS. Ruth is an expert in care of older people with a particular interest in person-centered care, people living with dementia, and safeguarding. This session tonight will also be live via our Hindu Council of Birmingham YouTube channel. Those members that would like to view the program again can do so. They can either log in on our website, www.hcb.org.uk, and also those members that want to ask a question via YouTube can do so. So further to do, over to yourself, Ruth.
Thank you. Namaste. I'm just going to try and share my screen with you because I've got some slides to show. So here we go, fingers crossed. It should do the magic. Yeah.
Yes.
Yeah, can you see that?
Yes.
Okay, lovely. Just another slight bit more about introducing myself. I'm actually a fellow of the Royal Society of Public Health, as through my qualifications and experience that Vipul has just relayed to you, I'm recognised as a specialist in the promotion of health and well-being and prevention of ill health. And my husband is Dr. J. Chauhan. He's also known as Chandrakrant, and I think some of you may know him. We've been married, and he hates me saying this, for over 40 years, and therefore I have developed a thorough understanding of the Hindu, Sikh and Muslim cultures, and I consider myself to be an active member of the Gujarati community. I thought it might be helpful if I just run through very quickly what we're about at Amber Care Solutions. So we're a not-for-profit health, housing and social enterprise agency. And we're all about well-being, so physical and mental well-being. And we look at health, housing and social care. We're very much about putting people first, and so everything that we do is person-centered. We believe that everyone is unique, and we ask them what matters to you so that they can actually take responsibility for their own health and well-being. And we provide advice and information and support to enable them to do that. So as I said, it's all about personal responsibility and people being independent, particularly people who are living with long-term conditions, so that they can learn how to self-manage those and hopefully stop having to go to the doctor so often, and also reducing the need to go to A&E and hospital. So it's all about health improvement. Our passion and vision is to serve others, so saver, promote a sense of empowerment and personal responsibility, and enable people to live their best life possible, and make a difference to the lives of individuals and communities, and take positive action to tackle inequalities. Our values are about having compassion for other people, and particularly those who are living with dementia and can't care for themselves. You know, it says a great deal about us as individuals and a community, the values and the attitudes that we have, particularly towards people who've got some great needs. And we need to care enough to want to do something to help. And we at Amber Care want to ensure that people affected by dementia in our families and community are able to live the best life that they possibly can. So this session is all about understanding dementia. And there's two main ways of looking at dementia. And the first is a medical model. And that focuses on the brain diseases and all the neurological changes that might be taking place in somebody's brain. The second model is a social model of dementia. And that really looks at how dementia is affecting someone's personal and social capabilities, how they're able to live their life. And following the social model of dementia, it takes a much more holistic view. So it looks at the disease, yes, but it puts the patient's lifestyle and independence at the centre of their care. And this presentation comes from the perspective of the social model of dementia. So let's look first of all at the main reasons why dementia is not recognised, particularly in minority communities. And one of the things is that there is no equivalent specific word for dementia in Hindi or in Gujarati. There's a lot of myths around about dementia, and I'm just going to go through some of those. People think that it's just a normal part of aging. And yes, it's quite common to have lapses in memory as you get older. You might go into the room and think, well, why have I come in here? Or you might lose keys. But dementia is caused by brain cells dying as you get older. And that happens with everybody. But in dementia, the rate that they die is much faster. People think that just because you've lost your memory, it might be indicating dementia. But that's not true, because there can be other reasons for it. And if someone's very confused and distressed, they think it's most likely that they have dementia. But some of the reasons for memory loss can be things like depression or delirium and confusion because of an infection. Could be lack of vitamins, for example, B12, and low thyroid levels. Another myth is that people think that when they get a diagnosis, their life is going to change immediately. And they worry about what they're going to have to give up. They think they're going to have to stop working. They might have to stop driving. They might lose the ability to make decisions, and that someone else is going to make those financial decisions for them, or that their family and friends will have to treat them differently. But every diagnosis of dementia is as different as the person who's receiving it. And lots of people can carry on working and driving and are able to lead a full and productive life to begin with. Another myth is that people think that there's very little that you can do to help them live well after a diagnosis of dementia. But there's a great deal that can be done so that people can maintain their independence and live as full and productive a life as they can for as long as possible. And hopefully by the end of this session tonight, you'll be able to see some of the ways that those myths can be dispelled and can be dealt with. And then one quite big thing is they think that dementia is a spiritual problem. So it's a punishment from God for something that they've done wrong in the past. They think it's karma that now they have dementia. And then that leads to the stigma around dementia, the stigma around mental health as well in general. There's lots of negative labels that are used to describe the person who has the symptoms. For example, they might say they're mad or they're losing their mind. The words that are used to describe the changes associated with dementia, they all tend to be derogatory. And that means that it's more likely that dementia is seen to be something to be ashamed of. So in comes the shame. And I think that what happens then is that people don't want to talk about it outside the family. They don't want the community to know about it because they're just ashamed of the taboo, and it's kept behind closed doors. And then there's the fear that comes with that. And sometimes that shame and fear makes them think that, oh no, that's going to damage a younger member of the family's marriage prospects. And using services can also be seen as a source of shame, as there's this expectation that perhaps older people will be looked after by the family. And they might therefore feel under more pressure within the community to care for a family member without actually seeking outside support. And this outside support is really critical. So what then is dementia? Well, to begin with, it's not the name of a specific disease, but it's a broad term that's used for a group of symptoms that together affect a person's memory and personality. The symptoms are a result of damage to the brain, which has been caused either by disease or by injury. The specific symptoms depend on what part of the brain is damaged and the disease that's causing the dementia. There's lots of different types and causes of dementia. There's well over 100, but the most common and the one that probably most people know about is Alzheimer's disease. And then that's followed by vascular dementia as the next most common. I talked earlier about the fact that as you get older, it's quite often that your memory begins to go a bit. But the thing that makes it different is when you've got the memory loss, but the memory loss interferes with daily living. So it's really difficult to perform even simple tasks like bathing or eating. You may forget to turn the bath taps off, and the next thing you know that there's a flood, or forgetting to turn the cooker, the gas off or the electric off on the cooker. Dementia, it's progressive, and that means that it gets worse over time. And at the moment, there's no cure. So the common signs and symptoms of dementia is memory loss, how quickly you can think, how sharp your memory and mental activity, and how able you are to solve problems, and language, such as using words incorrectly, or understanding what someone has said, or trouble in just speaking, and then difficulty in interpreting information, which you can see. And I'll just go through each of those in a bit more detail now. So someone who's affected by dementia, they might have loss or lapses of their recent memory and have difficulty recalling recent events, but they can sometimes remember things that happened from a long time ago. They might be convinced that they've just eaten a meal, but you know that they haven't. Or they might be unable to remember where they put things. Another thing that happens is they might keep repeating things in the conversation. For example, they might ask you the same question over and over again because they've forgotten that they'd already said that. And it's no good saying to them, don't you remember that you said that? They just don't remember. That memory has gone. Then someone who's affected by dementia might have difficulty thinking things through and planning, or lose their ability to make decisions. And that can be quite noticeable if somebody usually is very clear about what they want to do and working out things, and then suddenly they've lost that decision-making ability. But it's really important to remember that just because somebody's affected by dementia, it doesn't mean that they suddenly become stupid. For example, someone who's an expert in their field can still remember and discuss facts and theories about their subject. I think a good way of thinking about it is to think of the brain as a clock. So it's like a clock that stops ticking in an ordered way, but becomes very erratic. There's no pattern, there's no order, and the hands just jump around randomly. And sometimes the ticking and movement of the hands is frantic, and at other times it's painfully slow, and the alarm goes off randomly and unexpectedly. But on a positive note, sometimes their thinking can be liberated and they're willing to learn new hobbies and activities. Someone affected by dementia might lose track of time. So if you ask them what date it is, they can't remember, and can't remember what season it is either. They might get lost in somewhere where they're very familiar with, go out for a walk and then suddenly not remember how they're going to be able to get back home. They might forget where they've parked their car, and they might have problems concentrating and have difficulty carrying out a sequence of tasks. And as a result, they might make mistakes in things that they were previously really good at doing. And a good example of that is cooking a meal. So somebody who's been able for years to cook a meal, not having to look at a recipe, knowing exactly what the timings are and working out what they've got to do next, they suddenly can become very dependent on having to follow a recipe, perhaps writing down how long something has got to be boiling for. Just simple things like that. Might have difficulty in telling the time on a clock or on a watch. Managing finances is another good example. They might have difficulty in paying their bills, or going shopping in the days when you actually did use cash, being able to work out whether they've been given the right change when they've bought something. Someone affected by dementia might have difficulty finding the right word for something. So they might be thinking that they want to say chair, but in actual fact, what they say is something to sit on. They might jumble up their words and the grammar, and they might struggle to follow a conversation or misinterpret what they have actually heard. And this can vary from day to day. So some days you might think that there isn't a problem, and on another day it might get worse. And as the dementia progresses, then this becomes more of a problem. Someone affected by dementia, they might misinterpret what they see, and they see the world differently. And for example, in the room, they might see a nicely polished floor and they think it's a wet or a slippery surface and are frightened to take the steps forward to negotiate that. They might think that a rug is a hole in the floor and stop dead because they're frightened that they're going to fall into this floor. They can have problems in judging distances, and this is best seen when they find it difficult to go up and down stairs because they can't quite work out how high they have to lift their foot up. It might also mean that they don't recognize themselves in the mirror, or they might think that people on the television are actually talking to them. There's other things that you need to look out for as well. One of the things is changes in someone's personality and behavior. And this is an important form of communication and indicates a person's feelings and perceptions. The way a person who's affected by dementia reacts is shaped by their personality and their personal history, so things that have happened to them in the past. The changes in their brain can be really frightening to them, causing feelings of distress. Somebody who previously was very sociable might become withdrawn and depressed and doesn't like meeting people. They might just suddenly become frustrated, irritable, and angry. But the changes in somebody's brain doesn't make the person angry necessarily, but they can often become angry because they're experiencing something that they don't understand and it's making them frightened. They may also be anxious, easily upset, and become increasingly sad. And their likes and dislikes might change. One of the things that can happen is that they may lose their inhibitions and may talk about things they would never have done in the past, or they may even undress in front of other people, which they would never have done before. They may experience confusion and poor concentration because of the dementia, but it's really important to make sure that if somebody is a bit confused, that there isn't another reason for this, such as pain, distress, or an infection. There can possibly be changes in sleep patterns, and that can either be excessive sleep, so they just want to sleep all of the time, during the day, or they have difficulty falling asleep and staying asleep at night. Changes in appetite are another difficulty, and loss of memory and problems with judgment can cause difficulty with food and eating and nutrition. They might overeat, or they can lose their appetite. And as the dementia progresses, the person can often forget how to chew and how to swallow, or they may be distracted by their environment. So if there's too much going on, it's difficult for them to settle and to eat. Quite often, someone living with dementia is not seen as the person they were. They can just be seen as somebody that has dementia. But it's really essential to recognise that there is more to the person than the dementia. There's an African proverb, I think, which says it all. It says, every person is like all others. They're like some others, and they're like no others. In other words, every person is unique. So although everyone has the same needs for kindness and safety and meaningful activity, they have got their own particular needs. And beyond the basic needs that people need, which are different, it means that you need to be really specific about providing personalised care to meet the person's deeper individual needs. So it's about looking at that person, finding out what they used to do, where they'd come from, all those things that help you to understand the person better. There's differing opinions on how much someone with dementia can understand. And many people believe that just because somebody is with dementia isn't communicating, that therefore means they can't understand what's going on around them. But this isn't true, because what you need to remember is that the part of the brain that's responsible for communication is different from the part of the brain that deals with awareness. So even though they've got difficulty communicating, they're still most likely to have a good idea about what's going on around them and can understand the situation that they're in. It's likely that they do understand their surroundings on some level, even if it's only picking up on their caregiver's body language or mood. For someone to live well with dementia, they need to be treated as an individual by understanding who and what's important to them and how they like things to be. So you need to find out about what they can do and don't concentrate on what they can't do. And don't do for them what they can still do for themselves. Finding out about the person, to me, is best described as peeling back an onion, and layer by layer, you find out who they are. Layer by layer, there's different parts of their past that are revealed and come into focus until you see the very heart of the person. In the next few slides, I want you to imagine that the words that I'm going to be saying are spoken by someone who's living with dementia, and they're telling you how they would like you to treat them. So first of all, be patient. I've no control over my behaviour and actions. I can't always tell you what I need or want. Sometimes I can't find the right words. Please listen carefully and give me time to communicate. Look out for clues that might help you to understand what I'm trying to say. Don't assume that you know what I'm saying or want to say. Please check it out with me. It might take me longer to think about the answer I want to give to a question you've asked me. Don't be impatient if I mix up names and events. Please be patient if you have to keep repeating things. It makes me anxious when you say, I've already told you. Don't you remember that I've said that already? Even doing everyday activities might take me longer to do. For example, getting dressed, taking my tablets or eating my meals. Everything becomes more time consuming, and I can become very frustrated because I can't do things as quickly as I used to. I get really upset and anxious if people become impatient with me, and this can lead to me behaving in a way that may be difficult and challenging to you. I'm not sure I understand. I think my watch is trying to talk to me. So, let's talk. I need you to talk with me. Remember, it's a two-way process. Talk with me, not to me. Put yourself in my world and communicate in a way that I can understand and is suitable to my needs. But I also need you to give me a choice as to whether I want to communicate. For example, you could say, can I sit next to you? May I touch your arm? I may not be able to answer, but I can hear your voice and sometimes understand what you say. Speak softly, approach me slowly. Summarize what you're trying to say frequently and repeat again and again. Keep talking about my life and the things and people that are important to me. Remember your facial expression, body language, and touch, because they're just as important as what you say and how you say it. Be kind. Every day, my life is a long and desperate struggle. Please treat me kindly and sensitively by taking the time to just stop and listen to me. Be patient and understanding when I'm struggling to do something like getting dressed, or just offer a warm and friendly smile as you meet me or walk past me. Your kindness may be the most special and important event of my day. If someone is unkind to me, it may make me upset and anxious for the rest of the day, even though I might not be able to remember who was kind or what they did. Treat me with dignity and respect. I need to be valued and understood. Ask my permission before you do anything. I am an adult. Please don't talk to me or treat me as if I'm a child, and that includes not scolding me or telling me off. I can still make some choices, so please give me the opportunity to make those choices when I can. Remember that I still do have feelings. They've not got less, and sometimes my emotions are stronger than ever. Think about my feelings. Think about what you do or say, as this may affect my feelings. I pick up on your body language and tone of voice just as much as what you say. If you are calm, positive, reassuring, you're more likely to be successful in providing me with the help and support I need. Sometimes I just need a hug or a reassuring touch on my arm, but please be aware of my personal space and find out what kind of physical contact is okay with me. I may experience a different reality to you. Insisting on telling me the truth or lying to me can cause unnecessary distress. For example, if I'm asking to see a close relative who's dead, please balance truth telling with compassion. If you tell me that someone I was close to is dead, you will force me to experience that loss and grief all over again, as if it's new. Equally, if you lie and tell me they will be home soon, you will raise my expectations falsely. It will help me if you focus on my feelings and work out why I'm talking about my different reality. I may be trying to let you know that I have a need for closeness, acceptance, or affection. Or it may just be that I'm missing a favorite meal that they used to cook for me. If I'm trying to get out of the house and say I need to go to work or pick up the children, what I'm really trying to say is that I need to be involved in an activity that has value or purpose, or that I want to feel needed. Providing me with company, friendship, or a useful activity may help. My life is based on a true story. What I have done and where I am from makes me who I am today. To understand my present, you need to recognize how my past has influenced who I am today. My past is an important part of who I am. Talk to me about my past and encourage me to tell stories about it if I can. Understanding my cultural heritage will make sure I receive high quality and safe care that focuses on me rather than the dementia. When I'm traveling back in history, I'm experiencing it as if it is now. Help me to enjoy the things I have always enjoyed. My memories aren't simply a vision of my past. They are a link between the people and places that are important to me. The loss of my memories is about the way in which these links have become loose. You can help me re-establish these links by helping me to uncover my memories and remember things from my past. It's not what I forget that's important, but what I remember. Think about my future. I know the time may come when you can't care for me anymore. Please think about what I would want and how I would like to be cared for when I'm no longer able to make those decisions for myself. We need to think about lasting power of attorney for both my health and finances, and talk about what care I want when I'm no longer able to say. Don't be ashamed of me. I'm still a part of family and community, and it's important for me to be included in family gatherings, parties, and community events. If you don't include me in conversations or try to connect with me and involve me in community activities and events, I feel lonely and isolated. So what can we do then to reduce the risk and delay the onset of dementia? Firstly, we need to know the risk factors. The first one is age. And we know that as people get older, they're more likely to get dementia, but it doesn't mean that they will inevitably get dementia. Family history and genetic factors do play some part, but the genetic factor is more around the fact that it's vascular dementia is the risk, and it's the factors of high blood pressure, heart disease, and high cholesterol that's common amongst Asian people that increase that risk. So one of the other risk factors is high blood pressure, heart disease, type 2 diabetes, smoking and excessive alcohol, ethnicity. Again, that relates back to what I was saying about family history, about you being more likely to get vascular dementia because of the risks of the high blood pressure and cardiovascular disease and type 2 diabetes. Can also be a head injury, and I think that that's come to the fore quite a bit recently, with a number of footballers who've been diagnosed with dementia from heading the ball, and indeed they're looking at whether that should be banned, particularly for children. So how can we reduce the risk? The first thing that can be done is to eat healthily. So things like controlling your weight, eating fresh, unprocessed foods such as whole grains, pulses, fruit and vegetables, reducing saturated fats and limiting your sugar and salt intake. And one thing that people often forget is about drinking water. So having at least 6 to 8 glasses of fluid daily. You need to aim to be physically active every day, and any activity is better than none, and more is better still. And I don't mean that you need to go to the gym every day, just adding in walks, gardening, do it yourself, the household tasks, those all count towards physical activity. Find and do something that's going to exercise your mind and challenge your brain. So puzzles, crosswords, card games, reading, and even talking to other people is beneficial. And make good lifestyle choices. So don't smoke, drink alcohol responsibly, and no substance misuse. And be health aware. So see your GP if you're worried about your health problems. So if you're concerned that you may be depressed or have hearing loss, if you're not getting enough sleep, and it's a good idea to have your blood pressure and your cholesterol checked and to know what those are and have that done every year so you keep an eye on that, and have your blood sugar levels checked regularly. Then we need to take action. So being aware about dementia means that you can seek medical assistance when symptoms are present. So when you notice some of the signs and symptoms that I mentioned earlier on, that might make you think there is a possibility that you or someone that you know may have dementia, it's important to go and see the GP as soon as possible so that they can receive an early diagnosis and benefit from some of the treatments that can delay the effects of dementia, as these all needed to be started in the early stages of it. The treatments can control symptoms and can, to an extent, delay progression. So you need to seek support early and stay connected. So don't hide the diagnosis, but reach out for support, because this then enables emotional adjustment to the diagnosis. I've been able to talk about the diagnosis of dementia and the effect it has on everyone with friends and family to make sure everybody's aware of the risks and what you can do to prevent it. It's about communicating the facts and being open and direct, so getting past that, the shame and the stigma, and be willing to talk to it with your family, with other members of the community as well. Because I think the more we talk about it, the less frightened that we will become. And by getting an early diagnosis, it means that the person can live the best quality of life possible. So you can make adaptations to the home so that they can live in their home for longer, making sure that the environment is safe, and with the aim of promoting the person's independence. And technology now can be used to help people with this. For example, you can ask Alexa to remind people to take their tablets. And alarms can be used to alert you if someone has moved from the chair or from the bed, or if they've gone out through the front door. And you can also use GPS tracking if you've provided them with a phone or a watch. It's also important to help someone maintain a social life and be involved in the community. By getting an early diagnosis, then you can make plans for the future, because there will come a time when someone living with dementia will not be able to make those decisions that they need to for their future, and the plans need to be put in place really early. And I think that you've already had a session on writing wills and power of attorney. So this is where this comes in, and is very important to put into practice what you learnt in those sessions. It's really important to have discussion with the person themselves so that they can actually say, you know, I know that I'm going to get worse. This is not going to get any better. I know that the time is going to come when I can't make decisions for myself. This is how I would like things to be. So, you know, this is how I would like to be cared for. And one thing that I think people forget about sometimes is participating in clinical trials and research, because at the moment, nobody knows what causes dementia really. They're still trying to find the answer to that, not really sure that all treatments are effective. And getting involved in clinical trials and research is an important way of doing our part to be able to find that cure and that treatment. I think the statistics are quite frightening really, that 1 in 3 people who are born this year will actually develop dementia. And I think what people don't realise is the benefits that can come along with taking part in clinical trials, because they do complete health checks very regularly. So they'll do ECGs, they will check out blood pressures, they look for infections, they will send you off to have an MRI scan. So there's not just the benefit for other people and helping to find the cure, but there's also the benefit that you can get the physical assessments from taking part in them. I just wanted to talk briefly about Amber Care's dementia diversity, what we do. As I said before, at the very centre is the person, and the person who is unique. The first thing we have is something called Dementia Buggies, And this is sometimes somebody who's got lived experience of dementia, so that they can provide support to either the person living with dementia or the carers. And they can come from the perspective of actually understanding what it's like and the difficulties that can be encountered. And just sharing that experience helps people to understand and maybe find a way through the difficulties that they're having. We use volunteers to work with people living with dementia and their family or carer. We recruit volunteers from local communities, from temples, and they're given a really good training and understanding of dementia around safeguarding. We also make sure that every single one of them has an enhanced DBS check, because they're working with some vulnerable people. I said that some of them have lived experience of dementia, but that isn't essential. Somebody who's got a real desire to help people and who think that they might be able to make a contribution towards befriending people and just helping through the difficulties every day, that we welcome people, because we will provide training. Another thing we have is support groups. So support groups, and that's either for people living with dementia or again with the family and the carer. And we find that, I mean, during lockdown, we had to do it via Zoom. And that was more effective with carers. People living with dementia found a struggle to be able to get online and to cope with that sort of a scenario. But we're hopeful that very soon we're going to be able to get back to face-to-face meetings. And the best way that works is to have support groups sort of running along side by side, so that people living with dementia can communicate and can do some reminiscence, can play some games and whatever. And in a separate part of wherever you're meeting, the carers can meet together and perhaps discuss and get some hints and tips from each other. I think why that is the best way of doing it is because quite often, and it's very tempting, because perhaps the person living with dementia has been a bit slow at being able to respond when they've been asked something. And it's so tempting then for the carer to step in and try to fill in those words or give a response on their behalf. And so it's better to separate them out and give the people living with dementia that opportunity to be able to express for themselves and give them the time to be able to do that. Something else we have is the telephone advice line. And that is an open line for anybody to ring up for advice. It might be something simple. I don't know. My mum, she just won't have a shower, hasn't had one for 2 weeks. Can you suggest anything to help with that? Or it might be, it's becoming more difficult to manage dad at home. We need to think about a care home. Can you explain how I need to do that? We can explain about things like how to prepare for a social services assessment, either for the person or for the carer. So it's a telephone advice line to answer any questions around dementia. We also have a website which is there, and on that website you can get advice around different topics. It explains more about dementia as well. That, in summary, is me, and now I'm quite happy to take any questions that anyone might have. I'm going to try and stop sharing.
If you have any questions, by all means, unmute yourself and ask the question. Don't be shy.
No.
Hi, my name's Annie Ribeiro. It's just a quick question. If somebody's been diagnosed with cognitive impairment, is it likely to be leading to any form of dementia?
The jury's out on that one.
Oh,
I think
okay.
what they say is if you have mild cognitive impairment, so if I just explain, mild cognitive impairment is when there's some issues around sort of memory, but possibly not enough to be interfering too much with some daily life, daily activities. That can stay stable at that. They just have mild cognitive impairment and don't go on to develop dementia. But there are a proportion of people with mild cognitive impairment as a diagnosis who will then go on and develop dementia. So if you've got mild cognitive impairment, you may be more likely to develop dementia, but not necessarily. I think that's the thing with dementia. There's so many questions that are unanswered and people don't understand fully. And I think that's why it's really good to get involved in the clinical trials to just find a cure, find out the cause of dementia. I'm sorry, I can't be more specific and give you percentages of how likely it is or not. And but that's the view.
Thanks very much.
Any other questions?
No question is too simple, or just ask away. It's the only way to find out.
I think it's information overload at the moment. And
I think so.
Trying to digest it.
Yeah. Oh, what I was going to say is that I know that this is going to be available, isn't it, on YouTube?
Yes,
yeah.
It is. Yes.
Yeah. So if people wanted to go back over everything that I've covered, and then had some questions they wanted to ask, my telephone number is there. I'm quite happy to answer those questions. Or on the website, there's a contact form if people wanted to fill in their question there and send it, then I can respond by email or want to contact them by telephone, however they want to be contacted.
That's great, Ruth. Thanks a lot for that. Further information. Nobody's got any other questions they want to ask? Are there any areas anybody wants some further clarification on or further information expanding on?
Yeah, that would be helpful, because I'm coming back and I think it's about 4 weeks' time, I think. That,
yes.
And if I get plenty of notice for that, I mean, that's what I intend to do, is expand on some of these specifics sort of around how you can reduce the risk, going into more detail perhaps around the different areas that need to be looked at, perhaps some hints on that.
Okay, Ruth,
Okay.
Go on. And
sorry, just a quick question. I don't know if you've covered the topic about carers and needs assessment from the social services, because obviously I don't actually live in Birmingham, I actually live in Leicester, well, in London actually. But so I don't know if that will be a session that you could possibly do.
Yeah, I can do, because that's a really important, thanks for raising that, because the more prepared you are for what they're going to ask you, and the more you know about your rights and what to concentrate on to have the most effective assessment. Yes, I can certainly go through that. And I have an advice sheet as well that takes you through and explains exactly what it is, what's needed and what they are looking for. Yeah.
Awesome, thank you.
that's great. Okay.
And I suppose what I didn't mention is that we're working right across the UK. We've down in London with some Kenton Hall there. We've been working with some Dementia Buggies, but it doesn't matter where you are in the country. I think that's one possible good thing that's come out of the pandemic, that the world's our oyster, really. So if people did know somebody who was living with dementia, and they thought that it would be helpful if they had somebody to befriend them with a dementia buddy. You just need to get in touch with me. If we haven't got buddies in your area, then we'll quickly recruit people so that that is provided. And that we had received a grant from the National Lottery, a 5-year grant. So good news that I'm sure lots of people would be very pleased with is that Dementia Buddies, it doesn't come at a cost. The group meetings, that doesn't come at a cost either. Might ask for some help with venues, so where we could actually meet in groups or whatever. But it's just a matter of asking, and it might take a little while to be able to get it because of the process of going through obtaining volunteers if we haven't got them in your area. But we're very keen to work with all of the temples right across England to be able to provide that service.
So Ruth, I've got a question for you. So we've talked about people with dementia. We've briefly talked about people who live with people with dementia. In terms of support for the family members having to cope with that situation, apart from Care, are there any other organizations that they could turn to, i.e. from the council or from any other support group?
I think it's more from people like Alzheimer's Society, but I'll tell you an interesting point. Somebody from one of the local voluntary organizations contacted me this week to ask if we were going to be doing face-to-face, because they identified a lack of those services because Alzheimer's Society were no longer providing it. I think everybody is strapped for cash and have had to look very carefully at what sort of services they do supply.
Right.
But they could do. I think the benefit of what we offer is that the volunteers that we recruit are able to speak the language, so speak Gujarati, Hindi, if we're working with Pakistanis, Urdu or whatever, because one of the things is that as dementia progresses, it can become increasingly difficult if English isn't the first language.
Yeah.
They might completely, if it's a second language, they might completely lose that skill of being able to speak English, and therefore it's vital that they have somebody who's able to communicate with them in their own language. Just one point that I meant to raise, and you just reminded me, you might have noticed all the way through I was talking about people living with dementia or affected by dementia. One of the things that people often say is somebody's suffering with dementia. If you use that term suffering, it makes you think that they're a victim, that it's, it has all sorts of wrong connotations to it, and it's much better to talk about people living with dementia or affected by dementia. And if I could just clarify, I'm not sure that if Hamir, that you picked up that I was talking about carers. When I'm talking about carers, I mean family members. So the person who's actually providing that care. So not necessarily people like nurses or care assistants coming into the home to provide that care. It is the family and friends. That's what I meant by the person. Yeah.
Thanks a lot for that clarification.
Yeah. That's just, I'm just so used to saying it. You have to stop and think sometimes about what are you actually saying and what do people understand by that.
Yeah.
So if there's anything, if there was anything, that you think you didn't quite understand what I was saying, just ask. That's no problem.
I think a lot of people tend to hold back and not speak up. But it seems to be quite a taboo subject, really, doesn't it? Within the BAME community, I think trying to open it up and making people realize that, it's not a bad topic, it's life, And you know, there is support out there, yeah, and you know, you just want to share the information as to where you can get it.
Yeah, no, that's right. I think that the more it's talked about, and yeah, the better it will be, because it's so important that people actually go and ask questions of their GP if there's just even a slight worry that it's just a little bit more than that somebody's getting older. Because you know,
sorry,
as I said, it could be because they've got an infection. You know, it might be that their vitamin levels are low, or there's problems with thyroid. And when you go to see the GP because you've got concerns about your memory and whether or not it's dementia, they don't start from the point of, oh, you've lost you know your memory, you're having difficulty with that and whatever. They go into the mode of, well, let's see what else it could be. Yeah. And then we'll go down the road of let's investigate whether it is leading to a dementia diagnosis. So they'll do lots of blood tests and, you know, ask questions and, you know, how long has it been going on for, all this sort of thing. But GPs are really keen to see people and to actually exclude the other things that I mentioned that that it could be other than dementia.
Yeah,
I think that,
sorry, go on,
sorry. No, I was just going to say that, you know, there's that fear bit. People are frightened to go because they think, and all those things that I was talking about, you know, it's going to be the end of life as I know it. It's going to take away all my liberties and whatever. But the fact that it's progressive, it starts off in the early stages. And the earlier you can actually get that diagnosis, the more that you can change things like changing your diet, becoming more active, that you stave off some of that sort of fast progress of the disease. Yeah,
I think that's the other point I was trying to make. Is it's a bit, I know you say go to the GPs, but it's so difficult at the moment to actually get an appointment with them. So, you know, so that's why it's good to know that there may be alternative options available to try to get some support.
Well, between you and me, the best way of actually getting that support is to join a clinical trial.
Yeah.
You know, to get yourself registered on something like Join Dementia, Dementia Research, something like that. There's an organization called Recognition Health, and they're always looking, particular people from minority ethnic backgrounds, sort of Asian people, Afro-Caribbean, because there's a lack of research in that area. But, you know, as soon as you go and say to them, you know, I've got concerns about my memory or whatever, they'll have you in. And before they even put you on a clinical trial, there's no guarantee you'll get on a clinical trial anyway, because it's so specific what they're looking for in terms of your cognitive abilities, you know, how you can do those assessments that they do. They take a full medical history, they do your blood pressure, your urine, they do loads of blood tests, and they screen for all the vitamin deficiencies and everything else. And then they will take you through that, through the process. If you can't get to your GP, go and join a clinical trial.
All right, okay.
Good for you and good for everybody else.
I'll probably do that then.
Yeah, they're desperate for people from Asian backgrounds to actually join the trials, and it is well worthwhile. Because if they don't get you on a trial, they call you back for the next one, and then they repeat all the assessments again. So yeah, and they'll get you for an MRI quicker.
Yeah. But I guess that you know, when people do go to the GPs, and obviously the GP will do the baseline investigations and everything else, and they may refer them to the specialist to have the memory assessed, etc., etc. And I think that process kind of seems to take quite a bit longer. There seems to be a waiting list and months of waiting around.
Yeah, no, you're absolutely right. I mean, I think now that they're encouraging GPs to actually make the diagnosis and not send them off to the memory clinics to go through a whole barrage of tests and whatever. But you're absolutely right. I think it is it's months before you can actually get there. But if you're wanting to get to the memory clinic to be assessed by psychologists or psychiatrists, you have to go through your GP first of all, or go and do a clinical trial.
Any other questions? If you don't want to ask the question, you can jot it down in the chat and I'm more than happy to read it out.
There's 4 in the chat, isn't there?
Is there? No, that was me just sending people information, making sure that they were aware. So.
Yeah, I don't know whether you want to copy my telephone, my telephone number and my email into the chat, because people can take a note of it then.
Yeah, it's going to be shared on the website. It's going to be shared on the YouTube. Obviously part of this recording, so people will be able to review it and capture it as they need to. Okay, then, since there are no other questions and we're now hit the 1 hour mark, I think it'll be a good opportune moment to then close the session. Ruth, many thanks for participating in sharing your knowledge and expertise on this very difficult and sensitive subject. As you've already mentioned, we will be having some follow-on sessions. So anybody who has any thoughts on any other areas that of this particular topic that they want further clarifications on, or like Anne has mentioned about the assessment, we will be arranging further sessions on those points. And again, as Vipul has mentioned, and I've mentioned as well, this is recorded. It's been live streamed on our YouTube channel. It will be on our website as well, and within YouTube as well. So if you just search for Hindu Council Birmingham and then subscribe to the YouTube channel, you'll be able to then see all the recordings at that point as well. And anything and everything that Ruth has mentioned will be available to you on that platform as well as the website, which is hcb.org.uk. And that's it from myself. And Vipul, any last words from yourself?
Yeah, first I would like to thank, what's going on here? Yeah. First I would like to thank Ruth for a brilliant presentation, and thank you everybody else for joining as well. As Hamid Boys mentioned, a YouTube video will be going out to all members, and you can view this online as well. Also, on the 15th of February 2022 at 8 p.m, we have a seminar on how to maximize your tax benefits for the year end 5th of April 2022. So by all means, everybody can join that seminar as well. Yeah, I've got nothing much to say, but thank you, Ruth, and much appreciated, and thank you for taking the time to actually present the important seminar. Thank you so much.
Thank you, everybody.
Thank you.
Good
Thanks,
night.
Sam.
Have
Bye.
a pleasant evening, what's left of it. Bye now.
Bye.
Bye then.